everyone, my name is Cassandra, and today I'll be talking to you about the imaging modalities found in the medical imaging department at your local hospital. So with an imaging modality, you may be thinking of things such as CT, X-ray, and MRI, which you are correct. You also may be thinking that these are the best imaging modalities for imaging function and anatomy of the body. What I'm here to talk to you about and persuade you about today is that nuclear medicine is actually the best imaging modality for imaging the function of the body. So imagine that a 35-year-old man is in a hospital exam room. He's just had a whole-body nuclear medicine bone scan, and the results have come back positive for metastatic bone disease due to his prostate cancer. His doctor recommends that he goes for chemotherapy and radiation treatments to cure the cancer, and 2 years later, he is free of cancer. So what this nuclear medicine bone scan did for him is it caught the metastatic disease in time so that the disease didn't spread to the body and become incurable. Without the scan, the patient might have died. So you may be asking what a nuclear medicine scan is, or what nuclear medicine as a modality is. The dictionary definition of nuclear medicine is a branch of medicine concerned with the use of radiopharmaceuticals in diagnosis, management, and treatment of disease. So today we'll be discussing what nuclear medicine is and why it's the best imaging modality for imaging the function of a patient's body systems in comparison to other imaging modalities such as CT and X-ray, because of the utilization of radiopharmaceuticals, the birouting of the radiopharmaceuticals once injected into the body, and long scan times utilized in the nuclear medicine department. Last year I became a student at the University of Findlay, and I entered the nuclear medicine department in December at UPMC Altoona in Pennsylvania. I've been studying the use of radiopharmaceuticals in correlation to our scans and how to image the different body systems. I think this is important to you, the audience, because if you're ever scheduled for a nuclear medicine exam, or a loved one or someone you know is scheduled, you will know why nuclear medicine is the best imaging that shows function instead of CT and X-ray. So nuclear medicine is the only imaging modality that injects its radioactive material into the body. This is called an emission scan. This is unlike a transmission scan in X-ray and CT, where the X-rays or the CT activity is coming out of the machine towards the patient. In nuclear medicine, the activity is injected into the body and it's coming out and is detected by the camera. With the introduction of radioactive material into the body, there are a few different ways that we can get that activity into the body. Our tracers are tagged with different isotopes that allow different routes to be throughout the body. In X-ray and CT, the only thing that their radiation does is come from the machine and go directly through the body. It doesn't target specific areas or specific organs of the body. We use injections through IVs. We use oral administration. We also use inhalation of a different aerosol of a radiopharmaceutical, among many different other methods of introduction to the body. The different biorouting of the radiopharmaceutical depend on the body part that we are looking at. For example, in a hepatobiliary scan, we are looking at the hepatobiliary ducts and how they're working. We inject a radiopharmaceutical through the IV and watch the flow of the radiopharmaceutical into the liver where bile is produced, into the gallbladder where it's stored, and then when it's released into the small intestine, the bile is used to reduce fats as the digestive tract takes over as you eat food. In a bone scan, our radiopharmaceutical acts like magnesium or phosphorus, and it can tell us where the bone is trying to heal with different disease states such as arthritis, cancer, or other different fractures that X-ray and CT cannot see. This is why we're good for functional imaging, because it shows us where those problem spots are that CT and X-ray can't image at all. We also have a risk of infiltration, or not getting our radiopharmaceutical into the blood system, as it just stays under the skin and it doesn't travel anywhere in the body. This is unlike CT and X-ray because their X-rays are coming out of the machine instead of us in nuclear medicine injecting the patient with our radioactivity. Medical tracers are tagged with isotopes. We use technetium 99M the most. And we use other things such as indium-111 to tag white blood cells to show infection in scans that CT and X-ray cannot do at all. With the use of radiopharmaceuticals tagged with these different isotopes, we also utilize long scan times to capture the function of the part of the body that we're imaging. Take the hepatobiliary scan, for example, that I mentioned before. It's a 2-hour scan. The first hour we're looking at the liver and the gallbladder. In the second hour we introduce a synthetic version of Kinavac, which is a hormone produced by the body that contracts the gallbladder so that we can see how the ejection fraction of the gallbladder is working and if the hepatobiliary ducts are actually working as normal. We also do delayed images for things such as bone scans. We give them the injection, wait 3 to 4 hours so that the radiopharmaceutical has enough time to get to the area of interest, as in the bones compared to the soft tissue. We also give 6 hours delayed time for things such as thyroid scans, where we give iodine. The thyroid takes up the iodine in the 6-hour period so that we can image the size and the measurements of the thyroid. This is unlike CT and X-ray that image anatomy. Their scans are very short, usually less than 5 minutes, as compared to the nuclear medicine department, where we have 2 to 4 hour scans each time. Because nuclear medicine is a functional modality, we use long scan times to image the function of specific organs. We also use delay times to give the parts of the body enough time to take up the radiation and the radiopharmaceuticals so we can effectively image the function of the body part we're looking at. We can see that nuclear medicine is made up of a foundation of the biorouting of radiopharmaceuticals as explained in my imaging book. That's the author Mettler that we use to study all of the different scans that we do. And we use them to take images of the function of the body while using long scan times, 2-hour advantage, unlike those of the short scan times of CT and X-ray. The introduction of radioactive material to the body helps us to image and discover how the body is functioning and whether or not it's abnormal or normal. What the treatment plans are best for the patient and how we can fix their problems that are going on with their body systems. The use of radiopharmaceuticals tagged with isotopes take different routes throughout the body, unlike in CT and X-ray where they can't image function. They take a quick picture to analyze the anatomy of the body. Long scan times are necessary in nuclear medicine to capture how the body is functioning. And we also use time delay to our benefit to give the radiopharmaceutical to get to the time to the area of interest. Without the use of modern nuclear medicine as an imaging modality as compared to other things such as CT and X-ray and MRI, the 35-year-old patient, as mentioned before, would have died from their metastatic prostate cancer because the cancer would have gone to his bones. Nuclear medicine is a growing image modality that allows technologists to acquire images through the use of radiopharmaceuticals that show us function of the body through biorouting. I hope that if any of you ever feel the need or your doctor finds the need to image your body systems, I hope that you can discuss with them the difference between nuclear medicine and other modalities to help you make the best decision and to see why nuclear medicine is the best for imaging function of the body systems. Thank you.